The Sidda principal diagnostic methods were the 8 principal diagnostics, which is the tongue diagnosis, the color diagnosis, the voice diagnosis, the eye diagnosis, the urine diagnosis, the motion diagnosis, the perspiration diagnosis, and finally the pulse diagnosis. When all the 7 gives a clue about the diagnosis, the pulse, which can be used as a confirmatory for the particular disease diagnosis. Still, in the modern world, we Sidda doctors use both diagnostic methods, the pulse diagnostic method of the Sidda system and the modern diagnostic procedures. For example, when a patient with a disc bulge, we can identify the disc bulge with the pulse diagnosis, and further the patient is referred to a diagnostic center to take an MRI to confirm it. And finally, after the treatment, we again make the patient to take an MRI and we check the pulse of the patient, which is restored to normal. In general, the pulse diagnosis in Sidda system is read by observing the intensity of the 3 pulses, namely Vata, Pitta and Kapha. When the Vata, Pitta and Kapha are in the balanced state, the patient is healthy. When the imbalance or the equilibrium is disturbed, the patient have ailment. Restoring the 3 nadis, the Vata nadi, Pitta nadi and Kapha nadi, is the main principle of treatment in Sidda system of medicine.